Coexisting cataract and glaucoma is not an uncommon scenario, and when it comes to its surgical management, phacotrabeculectomy with Ologen is a good option. The Ologen, a collagen implant, improves the remodeling of the regenerating tissues and prevents scar formation, thus improving success rate of trabeculectomy. This video shows management of a case of cataract with glaucoma by coaxial microincisional cataract surgery with trabeculectomy with Ologen implant. This was a 65 years old female patient who had coexisting cataract and glaucoma, and then we had planned combined surgery in this case. Under local anesthesia, after making a conjunctival flap, the phacoemulsification was done. This patient had a semi-dilated pupil at the outset. Under cover of viscoelastic substance using a cystitome, capsulorhexis was done. Following this, meticulous hydro procedure was performed. And then phacoemulsification was done. Since it was a semi-dilated pupil, we did the phacoemulsification using combined method of stop and chop and chip and flip. It was a soft cataract as well. During phacoemulsification, the pupil became still smaller and it was not dilating despite the use of dilator. Very carefully, the nucleus management was carried out. Then the remaining epinucleus was also removed. And following this, cortical aspiration was performed. Since the pupil was smaller, we left behind subincisional cortex and first implanted the intraocular lens. So hydrophilic acrylic intraocular lens was implanted. And the IOL was rotated so as to dislodge the residual cortex. The remaining cortical matter was removed. And finally, the anterior chamber was formed with air before starting with trabeculectomy part. I prefer partial thickness triangular scleral flap. After making the scleral flap, the trabecular meshwork was cut. I use the knife to remove the trabecular block. You can see the block being removed and then peripheral iridectomy performed. We can see a clear-cut window after performing trabeculectomy. The apex of the scleral flap was sutured using tenonylon suture. This is Ologen, a biodegradable collagen matrix implant, 6 by 2 mm size, that is 6 mm diameter and 2 mm height. It was implanted subconjunctivally in a way that a part of it is just near the apex of the scleral flap. Following this, conjunctival closure was done. And here we can see the Ologen well in place. This is the first post-operative photograph of the patient, quiet eye, well-formed chamber, Ologen in place. And this is 1 week post-operatively, again a formed chamber, clear cornea, well-formed iridectomy and Ologen in situ. Thus, Ologen, a biodegradable collagen matrix implant, is a new, safer and more effective alternative in combined surgery. Thank you.